call to order at 7:05. Is Michelle on for doing a roll?
Yes, I am.
Do you want to take roll, Michelle?
Sure will. Okay, Strassman.
She waved her hand.
Oh, okay. I didn't see that. Hilla.
Here.
Roberts.
Here.
Cronin.
Present.
Johnson.
Here.
Miller.
Here.
Durst.
Here.
Schnapp.
Here.
Luganbull.
Here.
Chief Anderson.
Present.
Deputy Chief Dostelect here tonight.
He's excused this evening.
Okay. All right. I think I got everybody.
Perfect.
Okay, thank you. We have a quorum. Did everybody get a chance to review the minutes from November 19th, 2020?
We actually do have a public comment for us, Terry.
Oh, well, okay. Okay.
Yeah, you know
Go
you
ahead.
can't see him. So Kyle Wells is here to speak. I'll let you introduce yourself, Kyle.
Okay, go ahead, Kyle.
All right, thanks, Terry. For those of you that might not know me, my name is Kyle Wells. I've been with Fitch-Rona since 2005, part-time before that. I'm also the union steward, and my crews, they oftentimes ask me to speak on their behalf. They asked me to do so again tonight, and basically what they wanted me to do is they wanted me to extend their extreme gratitude toward the entire commission for what you've done for us over the past several months with COVID, with the emergency sick leave. Several people have had to utilize it. It's been, even for those of us that haven't had to utilize it, it's been just a great safety net feeling, right? That you guys have had our back. And we really wanted to make sure that you guys knew just how grateful that we've been for this sick leave. And we're really hoping that since we're so close to that finish line, and that a lot of us are getting, am I still on? Okay.
Yeah.
And that a lot of us have already gotten the vaccine, but our families still haven't. And there's a few of us that can't get it. And we're really, really hoping that you guys are going to help get us across that finish line and get through this COVID thing once we can get everybody vaccinated, families, populace, and all the rest, and just give us that little bit of an extension. And that's pretty much all I had to say, other than thank you for what you've done already. We really appreciate it.
Yeah, thank you, Kyle. Thanks for the positive comments, and we really appreciate all the efforts that you and all the staff are doing, helping deal with citizens during these really difficult times. And we have it on the agenda later, and hopefully we'll be able to move it forward. So thanks, Kyle.
Thank you, Terry. Thank you for that acknowledgement. That goes a long way.
So we move on then to review and approval of the minutes. Any corrections?
I make a motion we approve the minutes from November 19th.
Is there a second?
Second.
All in favor?
Aye.
I guess say aye.
Aye.
Any opposed? Hearing none, the minutes from November 19th, 2020 are approved as written. Chief Patrick, you want to go ahead with your report?
I'll unmute myself. Happy January to everybody. So this is actually kind of the year-end report where we ended up in with 2020. Changed the color in there. It's a brand new year. So 3505 is where we ended up with calls. I think I actually shared that at least that number for you a few weeks ago. When we are putting together, we should have the annual report done. Deputy Chief Dostalik has most of my data in there. I got to go through and update some paragraphs. Just to let you know, there's a little quirk in there. So 3505 is the number of ambulance calls. There's a different report, and that'll actually be in the annual report that pulls up. It says 3507. We actually were able to trace it back. There's actually 2 calls that the car responded to that an ambulance was never sent to because we managed it at the car level. So there's a little bit of quirky numbers. So this is actually just strictly ambulance calls, 3,505. So it ended up to be 1.8%. So we just rounded it up to 2% for the year. We anticipate we budget for 3. Historically has been 5, if you remember that. But we are still up comparatively, which as you can see the change as we've been talking the last 12 months, it's all over the board kind of COVID where we've been at for this last year. You can see our Narcan response is CAR 15, still staying really with that consistent 61% of our calls for the month. We're in the city of Fitchburg. The city of Fitch-Rona actually bumped up quite a bit. There's you'll see in the annual report we'll talk about, I think, next month. I've shared that little hotspot video or that hotspot map with you of like where our calls are occurring. The month of December, if you get onto any one of the public websites that show where COVID is, kind of some of the ages and the deaths and the number of calls and cases we've been getting, just December was really, really through the roof. November and December, Verona was one of those hotspots. So Verona was actually pretty high last month with 102 calls. As you can see, that was 70 the year before. So quite a few more calls in the city of Verona for last month. Our fractal times, as I report to you, are right where we want them to. On-scene time snuck up a little bit to a little bit over 15 minutes. We like to keep that under 15 minutes, but 0.68 cents. So we're tracking as far as our average, our medians for the year. We just actually finished our ALS consortium training 2 days ago, so I just didn't get it updated before I updated this the slide. We actually did some MCI training, some mass casualty training, some triage training, Dr. Mancera, and then I don't know that I have shared since July or so when we've been working with the UW consortium. So Dr. Kim is a UW pediatrician. So he's actually been very involved with our training every month, and every topic that comes up, he actually speaks a little bit and brings the pediatric perspective to every topic we bring. So he actually did a pretty good presentation on taking triage and applying it to kids. And then January is our annual bloodborne airborne. It's kind of a little bit of a torturous video because everybody watches pretty much the same video every year and learning about all the things that we shouldn't be touching. Little skew on it for maybe a new virus. We saw this last year, but otherwise that's what we've been doing internally. Still no community events going on for us. You can see there's where we're at for calls of the day and day of the week. And you can see for the month of December, proportionately, Fitchburg actually went down a little bit because we cranked out Verona a little higher. As usual, sick person and falls, it's number 1 and number 2. Only other things that we creeped up a little bit more that we usually don't see is fire standbys actually made it its top way to our top 70% of our calls last month. Still seeing that proportion by station, seeing that middle station 44 or station number 2 there, still getting predominantly the number of calls. It's right in the middle of the district. That makes sense. Although again, we saw Verona creep up quite a bit last month. So this is our aging report. Everything is absolutely where it should be, with kind of that rise and fall of where we're at with billing. Huge month in December. So we see a little bit more in that 0 to 30 days out. As far as our cash goes on hand, we've still been able to make payroll, so we're still doing pretty good. It's kind of where it should be. Right at the end of December is feeling a little tight on being able to pay bills, which means that we budgeted appropriately, right? So at the end of the year, I should be out of money because we paid these bills appropriately. So there we are, based on the end of the year. Payroll, and again, bills are the only thing that came out of there. The other 2 deposits were interest. Again, the big whole $9.30 we're making on our retirement fund with the way the market is going in there. No changes to our assigned funds at all. The ambulance CD will come due, I think, in February. So we'll actually be cashing that one in to apply towards the 2021 purchase. That is, so 2021 as far as our CIP goes, 2021, right, a new ambulance every other year. So we'll actually see a new ambulance next year. It's about a 6-month build. So that was actually, it is ordered. It's on its way. We should see it in June or sometime. I'm slowly starting to work down the checklist of all the things that have to go in it. There's some updated radios that we need to start building into that project as well. But so that CD will get cashed in. We will sell then our 2011 ambulance. Fortunately for us, it's actually still in really pretty good condition. it'll probably be only right around about 100,000 miles by the time we go to sell it. So I'm actually hoping to get significantly more than we've gotten in the past for those ambulances. That'll go back into a CD again then for 2 years to help offset the future purchases. Then we're sitting there with our post-retirement healthcare fund. That is going to be pretty good here for another 1 or 2 years here, and then that'll be a discussion. Probably will wrap around in July, and talking about though this is very well funded. We also actually have a very aging workforce, so we're gonna have to keep an eye on that in probably the next 5 years budget or so, as we're gonna start getting to tapping into that in about the next 5 years. As I've always said, right, I got my 10-year mark out there, so I need to make sure that in 10 years from now, there's some funds in there so that I can cash it out and pass that baton on. But otherwise, we're sitting pretty good. We got a couple donations last month. So normally PlayCon actually has a Thanksgiving, a holiday dinner for all of their employees. And then they actually invite all the public safety services from Fitchburg. So that's police, fire, and EMS. And then they actually make a $1,000 donation to each one of those services. Obviously it didn't happen this year. So they actually just mailed us a check. So I sent them a thank you for that, but we received a $1,000 check from them. A Fitch-Rona resident gave us a $500 donation. Actually, every year there's an annual donation they make to us. So a thank you to them. And then without sharing a lot of patient information, we had a pediatric patient last month who had underlying medical problems who actually ended up passing away. That family actually gave a $1,500 donation and very thankful to our crews for the care that they gave for that patient. But then they gave that to us. We'll actually be looking to upgrade. We have some pediatric equipment that we're really looking to upgrade. So I'm actually looking at probably applying that towards purchasing or replacing some of the pediatric equipment we have on our trucks. So those are some donations. I'd like to recognize those people that provide those funds to us from the public. And then as far as our January milestones, this is Patrick's 20 year. So January 3rd was 20th year at Fitch-Rona. So you're one because I had it on here. Right, but then I brought you up in July because Kyle's on here, right? Because you actually started as a part-timer in July and then started as a full-timer in January. So when July rolls around, then we're going to get 20, 15, 16 years, I think, right? Or is it 17? There we go, 19. It's creeping up there. So that is why, right? It's always a little bit tricky. So David Snow is 16 and Molly, I think, is off a little bit as well. People who transition, they start as part-timers and then become full-timers, and that date changes on that spreadsheet somewhere. And I always got to look back and see how many years it's full-time and how many years it's part-time. So Kyle he's with that little last hiring group of the David, Molly, Kyle group. So 16 years as a full-timer, but both him and Molly actually have more years than that as part-timers. So big shout out to them. As I mentioned, I don't call it an aging workforce because I'm in that group of aging workforce people. Let's call it experienced providers that we have in these little hiring groups that we had. But we have one of those groups it's a January group. That's what I have for the Chiefs report. Any questions on that? Otherwise, I do have the financial one. We can hit that one really quick as well. So the official audit is February 2nd. Is that right, Michelle? It's the 2nd or the 4th. It's on the 2nd. It's on the calendar. It's again with Johnson Block. It will be. They're going to be doing it remotely for safety. We're trying to keep everybody out of the station. We've had COVID has kind of reared its ugly head again with the Fitch-Rona Fire Department. So we're just trying to keep everybody out. Michelle's been doing a phenomenal job of gathering all the documents and going to send it off their direction, and then we'll be available to answer questions for them. So that day they'll actually do that official 2020 audit review. So this is essentially coming from QuickBooks, where we're at based on income and expenses for 2020 at the end of December. There still tends to be Fitchburg's not on the line. Fitchburg tends to send us the bill for like the last quarter of the year, not to like February or March or something like that for fuel use. So there's a handful of bills that will most likely come in that will be applied back to 2020, but this is, as of the moment in time, is a pretty good snapshot. So we're actually pretty far under unanticipated run income, and I brought that up in the past. this year is my plan is to go back and see and look at that what that breakdown is. It's changed pretty. I did take a look at it for the 2021 budget. The new station out there has changed the proportion of calls that we've been sent out to. So previously getting dispatched to a call or no transport, an intercept, that formula worked out, and I could put in there that we did 3,000 calls a year, and the magic of LAN, right? It did the math and said, this is what you should expect in run income. That proportion has very much changed over the last 2 years. So when I put in there, run volume was down just about 100 calls from what we anticipated anyways. But that formula doesn't work anymore for me just to go 3,600 calls. This is what we should expect in run income. So we'll revise that for next year. So unfortunately, run income was down. Fortunately, so were expenses. So we received all of our other income that we had planned to come into, and we actually received a little bit more interest than we were planning. So it ended up a little bit, again, run income's down. Our total revenue was down. But as far as other expenses that we've seen, this is one that you see every month. Everything else is very much where we anticipated it to be. As far as salaries, we did have the unscheduled overtime, which I brought up back in July, August. Historically, right, that's the sick time. We have a phenomenal pool of LTEs, and we actually just picked up about 4 more of them. Because of those LTEs and the availability, mandating staff back and having staff, no, right, they like the overtime, I think, but some of them like the overtime. Those LTEs have actually been able to pick up a lot of that overtime, saving a lot of that unscheduled overtime cost. And so that line item, if you remember, is actually when we were able to reduce by a pretty significant amount next year, kind of relying that that LTE pool is going to stay solid and help us keep those costs down. There's always the unanticipated. When we went back and looked historically what that number was, it just takes one back injury, one knee injury, one motorcycle crash to start making that number creep back up as we have to pay to get that shift covered. As far as the rest of the operational expenses go, right, as I've shared, that medical supplies number 125% over, which is actually not too bad from where I thought we were going to be. It's been a couple weeks into the new year here. Not making the supply chain run quite as smoothly, but have been doing a lot more shopping around and comparative pricing to just be able to get stuff and keep the supplies down. Our usual supplier, right, I tell you every month our usual supply of gloves goes up. For comparison, 1 year ago it was $97 for a case of gloves. As of January, it's $223 for a case of gloves. I found a new supplier. I've been able to bring that now. It's kind of the wiggle room of the old supplier we had allocates gloves to us so I can get them. So I found a new supplier where that I've been able to reduce that cost significantly, not down to $97 by any means, but able to reduce that cost and to find the happy road as well to make sure that we can get that supply. So that's where we are at. Our medical supplies. Other stuff that we went off, that staff support line item, that's actually where much of the COVID cost went to. So the additional cost of purchasing disinfectant, the fogging machines for the stations, a lot of that PPE stuff we put in the staff support line, figuring that was probably a good place for it. Uniforms, the reason that one actually to me went up so high is because we did bring on 5, 6, 7, almost 8 new LTEs last year. So that I probably need to bump that line item up a little bit more when those new LTEs come in. Our full-timers have a uniform allowance that's budgeted when we hire them. They get uniforms, they have a uniform allowance. Our LTEs don't have a uniform allowance. So to outfit them when they first get hired and replace their uniforms is not a budgeted thing. We have a storeroom full of shirts and sweatshirts and stuff, but that's why that one creeped up a little bit. Same thing with the personnel recruitment. We did cancel our subscription, as I had mentioned, the unanticipated cost of that NeoGov platform. It went up again in 2021. So it's just it's not worth how much we use it. It's a phenomenal program and love it, but not for the cost of it. Spent a little bit more on medical equipment than we had meant to. That's the unanticipated cost of replacing, I think it was a stair chair this year. And then same thing, safety equipment. There's another place we actually put some of those disinfectant supplies. I don't know why the property insurance was higher than it was, but it got raised for last year. So in the big picture of stuff, as far as my math or what QuickBooks tells us, we actually came in $77,000 under budget. Again, at the end of the year, not too bad. We should be technically out of money because we budgeted appropriately. So some more bills should be coming in. Any questions on either one of those two things? You have this document, so. I'm okay with no questions. But again, the audit will be February 2nd when they'll get in there and dig this a little bit deeper. And then that document usually comes out. I think we get 2 copies printed, otherwise it'll come out digitally, and I'll share that with you in March. So are you still with us, Terry? And nobody's.
I'm still there, yep.
Okay.
Okay, any questions of Chief? If not, thank you, Patrick. Chair's reports, I'm assuming Personnel Finance did not meet.
Correct.
Let's move on to review and approval of accounts payable checks. Everybody get a chance to look at it, I'm assuming. Any questions about any of the items?
In the accounts payable, you had 2 paramedics that received training. Can you tell us what they received the training in?
There's probably, over the last 3 months, I think, I would have to go back and look. I can look that up and shoot that to you. Most of them, it's because they're working toward, if off the top of my head, it's 2 of them working towards one of them I believe is working towards their associate degree in paramedic. So I actually think it was one of their gen ed courses that'll apply towards their associate degree. The other one I think was an anatomy and physiology class towards nursing. We have one person working towards their nursing. We have a couple working towards like a public health master's degree. Couple working towards their EMS, their paramedic associate degrees. So I can look that up for you on that list and let you know, Mike.
Okay, I was just curious. Sometimes you say you can't say, and I know it's just good.
Yeah, I think if we were writing them a $2,000 check, I think I can share with you what they took. I can't give you the grade, but you can just know that they passed it and that it applies. Shannon.
Okay.
Oh, Shannon's got a question, Terry.
Oh, okay. Shannon, go ahead.
You're still muted, so.
Nope, can you hear me?
There you go.
Okay.
Yeah.
So I know like you guys have what are some of the options for some of the like your paramedics or your EMTs? How are they able to get their like continuous education credits? Have you had any problems with that this year because of the pandemic?
So the rules, and this actually, what I think the biggest challenge was, so every EMS license in the state of Wisconsin, it's a dumb design to me, but so all 80,000, however many EMS providers there are in the state of Wisconsin, they all expire on the exact same day every 2 years. So this year was actually that year, right? Sorry, I think
it's March 31st.
June. Registry is March, June 30th. Yeah. So they did actually extend it by 90 days. There's a couple options, and actually it is built into the contract, the collective bargaining agreement. So part of our contract with UW, so when we see that medical director fee in there, that actually pays for the continuing education process. So every month, the UW does present a 2-hour block over the course of actually starting in 2020. The state of Wisconsin now has extended that to a 3-year licensure period, which is just a whole other challenge in and of itself. The process for those who need to the National Registry, but that's another topic. So over the course of the next 3 years, every month UW actually does present, it's the second and third Wednesdays. It is a 2-hour block. It is broken down into the exact number of content hours that are required to maintain your state license. That's what we pay that $33,000 for. So at a minimum, if nobody ever wanted to attend, and it's done again in what we haven't met live for quite some time now. The state of Wisconsin and National Registry actually also waived the distributive education there used to be a limitation on how much you could take online learning. That was actually waived for this period. So they're provided with that in-house training. If they don't attend in person or in video, it is recorded and they can do it on shift. In addition to that, every one of our medics is given 36 hours of paid training every year. So if they choose not to attend that training, they can actually go outside, and the number 36 came from National Registry, the National Registry 72 hours, which was required to maintain National Registry every 2 years, which is above what the state was requiring. That number has since changed, but they can take that outside of what we do. In addition to that, the PALS courses, ACLS, so all their certification courses that UW holds, all of those are also in part of that fee that we pay, and every one of the medics is required to take CPR and ACLS. So and in addition to that, and that's probably what Mike was referring to, in their union contract is actually the potential for up to $2,000 a year in tuition reimbursement. As long as those courses have some application to educating yourself towards EMS. So like I had mentioned, we have a couple going to nursing school, public health, that paramedic associate degree. Some of those will actually count towards that certification process based on the topic hours. So there's a multitude, there is no lack of training opportunities, paid training opportunities.
Thank you.
Any other questions? If not, is there a motion to approve the accounts payable checks?
Make a motion to approve the checks.
And a second?
Second.
And all in favor of approving the checks as submitted, signify by raising your hand or saying aye.
Aye.
Opposed? Hearing none, the accounts payable checks as presented are approved. Next item is the MOU with Local 311. And I guess the issue is whether we want to extend it. It expired December 31st. It's what Kyle talked about. That was much appreciated by staff. Chief, you want to comment about it? I know there's kind of an issue between the cities on this, but
Yeah, so I'll give you the quick nutshell. You'll see it up there on your screen there. This is the existing MOU, just described what we want. This was a federal mandate under the Families First Coronavirus Act that provided emergency sick leave for COVID-related things to, again, mandated it to employers. Now, the federal act actually exempted first responders and protective services groups. However, right, that's the group that's out there taking care of COVID patients. So most municipalities or entities decided to allow that same, essentially those same benefits to our protective services. So we matched what most other agencies did in the county. We gave up to 96 hours. So that was actually 4 shifts, right? That 14-day quarantine period, 96 hours. You can see essentially the criteria that was required for that to be used. So this was above and beyond their personal sick time, right? We gave them 4 days should something happen. I know I talked to a handful of members, commission members who called. So in a nutshell, we did actually have 3 people who did use the whole 96 hours. They were actually quarantined either for a personal, we'd have 1 person who did test positive. The other 2 met the criteria for significant exposures. Again, there's some very clear criteria that we share with our staff that is developed by Madison-Dane County Public Health, as well as Dr. Casey Cronenfeld, who's the county medical director. So I have worked with her. So we had 3 people who did use their whole 96 hours. We had 1 person who used 24 hours. That was just 2 separate occasions where essentially, as it says here, if you meet the symptoms and you are seeking a test, right? So if Patrick works tomorrow, right? Then and tonight I have the potential fever, chills, scratchy throat, something that the list of criteria that is published out there for COVID. But I'm going to get tested tomorrow, or it's Friday, and I'm going to get tested on Saturday, but I'm not going to have my results back by my next shift. So either you have the symptoms or you are seeking treatment or seeking an evaluation, as it says here, you're given your COVID leave. So we had one person who used 24 hours, and then we had actually 4 other people who used 1 day. So that was a total of 429 hours. So that's who we've used it so far. For most employees, there's still actually a pretty big bank there, and those are the criteria that you had to meet. That expired. That federal act actually expired at midnight on December 31st of this year, as per this MOU. Because there's a monetary value assigned to our sick hours, right? It was essentially a use or lose. We were hoping when we signed this back in May that this was going to be at least done or under control. It's not, if you were not aware of that. So we're still seeing, we did actually have a huge spike, as I shared earlier, of it was 3 or 4 patients daily that we knew were positive. I would say maybe from 3 and 4 down to 1 and 2. We're still seeing it out there. It's still being screened, and we're still taking all those proper precautions. So what I am aware of, I can speak on, well, for Fitchburg, Shannon might be able to help us out a little bit what actually happened at the city, or you can just nod your head. What I believe that was extended for police and fire, it was supposed to be extended through March, but it got extended only through from February, based on anticipating the federal government coming out with some new guidelines. Would that be correct?
Yes.
Or do you want to tell us, Shannon? Is that correct?
Yeah, you're right. And I'm
Great.
sure in February we will revisit it, and if we need to extend it, it probably will get extended.
So they're just kind of moving it on forward. They're really anticipating that the federal government's going to come back out and provide some new directive. And then I've talked with Kate. Do you want to, I can give the nutshell, or if you want to give it in a nutshell, what's going on with Fitch-Rona?
Sure. So this actually will be coming before council on Monday. So we haven't actually officially made a decision on this, but it is my understanding that the city of Verona also intends to extend access to these hours. I have not seen what the timeline is, and we do also anticipate, hopefully, that there would be additional federal funding coming down the pike to help pay for this.
So the proposal for you tonight is that it would, in line with our other municipalities, right? So we don't refill the bank. The people, oh, Mike has a question.
Is the quarantine time, I thought it got dropped down to 10 days now.
So that is a great topic of discussion. The guidelines have changed. I think our last count, we're at about five different versions of the back to work guidelines. We have stuck with the same, abiding by what the CDC recommends, but most what we've been doing is working with Dr. Cronenfeld and saying, applying the guidelines consistently to all of the employees. So there's still a bunch of different tracks that go back to work, and I can share those with you. They are, because there's so many different pods, right? I'm sick, but I don't have any symptoms. I test positive, but I don't have any symptoms. I do have symptoms, but I don't test positive. I have a family member who is symptomatic. I have a family member who's tested positive, but doesn't have any symptoms. There's so many tracks. So we have relied on, I think it's back in July, September or something, we posted that the last set of guidelines. The safest, and it is still out there, still the safest route to take is a 14-day quarantine. There are some exceptions out there. There's 10 days without a test, except blah, blah, blah. 14 days is still kind of the best guidelines, as long as we're not having any staffing issues, because these are the guidelines, and then there's a whole bunch of exceptions. So what we have stuck with is the 14-day guidelines. We have not so far had any issues covering shifts, staffing issues, taking ambulances out of, back in March, I shared with you our contingency operation plan, like how many people can I lose before I got to start shutting ambulances down. fingers crossed, knock on wood, that we glad we never had to activate that. So the long answer to your question is, we have still, so that we're treating everybody the same, based on those guidelines, is if you meet that criteria, we are requiring 14 days before you can come back to work, right? In the spirit of giving people 96 hours, it was 14 days. There's still we pull that document out literally every time we have to deal with this, and usually every time we call Dr. Cronenfeld and say, so this is what I have. So,
Okay,
the issue,
any
yeah. No, I'm sorry, any other questions?
Oh.
Otherwise, I guess my proposal and the discussion amongst yourself is, keep the same guidelines, keeping with the municipalities. You don't get the pot refilled. So there are 3 people who are out of their COVID sick leave. Should it come up again, they're into their own sick leave bank. But the thought would be my proposal would be to extend this. We don't know how long this is going to take. We can pick March 30th. That's what Fitchburg is doing. Sun Prairie went to like April 15th because that actually coordinated with some policy renewal. Verona has yet to pick a date. I thought we can shoot this out till April, May, June. I would really hope by that time frame that we have a handle on this. As far as I am aware, most of our staff, I don't have solid data yet, most of our staff has been vaccinated. I only know of 4 people who have chosen not to. Reasons are their own. We don't mandate it. So I guess I'm looking for a proposal of how, if you think you want to extend it, and when you think you should extend it to.
I make a motion that we extend it to March 30th or 31st, I guess. And if it needs to be revisited, we can. By that time, they should have their second round of shots in. So theoretically, they should be covered. Correct?
Second that.
We should probably include, and I don't know if you want to amend your motion, that to extend it to whatever day you propose, with the caveat in there that this could be preempted, I guess, by some new federal guidance.
Oh, no, they never change anything.
Yeah, it may change. So March 31st,
Yep.
we would extend it. Okay, that was a motion, Mike, you made it. Was there a second?
I'll
I
second.
have one more thing. Oh, we can second it. Then I have a discussion point here.
Okay, go ahead, Mike.
The however many people that didn't get their shot, for whatever reason, if they get it, do they still get covered under this?
That is a question I have asked a bunch of other chiefs and municipalities. Nobody is taking the approach of tying this benefit to mandating a shot.
Yeah, there could be medical reasons, and who knows. I have another question. Assume somebody gets the shots, and they have a family member who gets COVID-19. Are they still, even though they can't get themselves, can they still spread it?
That my understanding is that is still one of the huge unknowns. That even though you have the vaccine, you can carry it. Somebody coughs on your shirt and you wear your shirt to work, you can still spread it. So we have yet to. Shannon, do you know more than I do? Go ahead.
No, but I was also saying too, if you're asymptomatic, even right now, they say you still have a chance of spreading it to others. So whether you have the vaccine or somebody else has it, I think it's kind of unknown at this point. But at least that's my understanding.
Sue, do you have any other insights on?
Not really.
Okay.
Yeah, you can look something up and get 10, like you're saying with your, you can get 10 different answers depending if it's from CDC, IHI, our own public health.
Right.
Nobody really knows. And now you have a second strain, so who knows what what you have or don't have.
Right.
Yeah,
So the
well, a
answer
lot
to
of
your-
them won't.
That's what they're
Okay.
saying, that even if you have the vaccine, you should be still wearing the mask.
Yeah. So yeah, the answer to your question, Mike, is yes. If you have a family member who tests positive, we're still requiring a 14-day quarantine before you can come
Okay.
back to work for Fitch-Rona. That is different for different employers.
Yeah.
Biggest thing for us is just the consistency of treating everybody the same since this started. Because we have had people who were asymptomatic and never tested positive. We made stay home for 2 weeks. We don't want to spreading it to our
Okay.
patients either.
Any more discussion? If not, we have a motion to extend the current agreement to March 31st, 2021. All in favor, signify saying aye.
I
Opposed? Hearing none, we'll go ahead and extend the MOU between Fitch-Rona EMS and the union to March 31st, 2021. And we'll have to get it, I suppose we'll have to sign it and everything then too, right?
Yep.
You think?
I will.
Yeah.
I will disinfect it and put it into a hermetically sealed bag and leave it for you somewhere, like 2 blocks from the station. We'll meet at Quick Trip somewhere, Terry. We'll get you to sign it and pass it back and forth. And
Okay, well, hopefully I'll be getting my shots soon. I'm in that age that I'm eligible starting next week, so
sure.
we'll see.
Yep. We'll get
Okay.
that typed up. We'll get it routed. Thank you.
Okay,
The staff thanks you. The only other thing I would have as far as a discussion point with this is the contract with the union. Jeff and I are non-represented. We put a policy in place to cover both Jeff and I that had this exact same language in it. I would get, rather than have to do a whole policy change, I would just guess anecdotally, or if you want to discuss it here, not making a formal policy change, that same policy extension would apply to myself and Jeff. If we
Heck, no. Yes, it counts.
all right.
sounds reasonable to all of us.
Sorry. Okay.
Let's see. Oh, then we have item 9, discussion of the joint municipal agreement.
Sure. So kind of as I shared with that, and I've got it. I can pull it up here, something for you to just stare at. I shared this in the email. I reached out to the municipal leaders. So I actually met, just kind of, I wanted to put some feelers out and see where we were at with this. So I actually met with Mayor Richardson, Mayor Diaz, and then the town board president, Mark Geller. I actually talked with them last fall about our intergovernmental agreement, right? This is what makes Fitch-Rona. The original intergovernmental agreement, 1977. I believe I've found a version that was updated in 1980 something. The version that we currently operate under was last updated in 1998. So the current intergovernmental agreement that creates Fitch-Rona is 23 years old. There is language in here that, I don't call it grossly outdated, but it's grossly outdated. The commission doesn't have a treasurer anymore. I mailed this out for you to look at, or emailed it out. The officer's position, like I mentioned, we don't have a treasurer anymore. Most of the jobs of like the secretary, our current intergovernmental agreement still has the commission writing checks, which you don't do. The capital improvement guidelines in here, again, are 22 years old. None of our municipalities operate with that same dollar sign anymore. Those are the things I'm actually just looking to have updated. So the kind of concern, and I'm bringing it up to this group, it's 23 years old. We've managed to function. I can probably track back for 23 years worth of minutes that changed the intergovernmental agreement to the current way we currently operate. But talking with those mayors, they felt comfortable opening this up, at least for some discussion and some revision to bring it up to date, and then re-sign it and put it back into practice. None of them were super interested in tackling some of the controversial things that have come up in the past about dissolution of the district, how the district is funded. I guess if this opens up, that will get asked or at least approached. I guess my current thought is I'm pretty sure we have some supportive municipalities at this point, and I think we can open this up for revision. I do not entirely know the process of how one goes about updating an intergovernmental agreement between 3 municipalities. So that's kind of on my homework list, but I'm bringing it to you as a commission to propose that we look at this. I actually do have an edited version, crazy, already done, that updates this. Or if the commission wants to form a subcommittee made up of the municipalities to look at this and revise it, and then send it out to the municipalities for their review. Or we can leave it alone. Discussion.
Yeah, one suggestion, I guess, would be to have the elected members from each of the 3 municipalities maybe get together and go over it, make some recommendations. The stuff about the secretary and treasurer, we're kind of dealing with it. I mean, it says you can be assigned or designated to staff members, which is what we're doing.
Mm-hmm.
So it's not like a crisis there, but it would be nice to get it cleaned up, I think.
It's really hard to say not to update something that's not up to date and 23 years old.
It's aged well, but it's time to, refresh it.
Patrick, what I'm thinking is, let's see your amended version here.
Good.
And that you have already kind of set up. You normally scratch off the lines and put in what you think it should be.
Yep.
And maybe send that one out for next month, and then we can look at it. If we like it, then maybe we can see if we can say, okay, we're changing it from that to this. And then you don't have to get politics into it.
Okay.
That's my 2 cents worth on it.
So I guess what I'm hearing, and the goal of tonight was just to run this by you and see, looking as the commission kind of giving me directive to update the intergovernmental agreement and move forward with it, and not to tear it apart and tackle it at this level tonight anyway. And then we can at least look at it. Probably, I like who Terry's idea was, whoever that you can look at it as far as the represented leaders, because this is going to go back to municipalities and get eaten up again. So we can kind of do our best job to put something together. But I guess what I'm looking for you, and I don't even know that it needs to be a motion, because in the end, if nobody can agree on changes to the intergovernmental agreement, the current one stands, and we're no different than we are. The whole thing can get flushed, and we drive on for another 10 years. I did obtain copies from, I believe it was Wanakee. I don't have it in front of me. Wanakee. There's a number of other districts in Dane County. I am proud to say that ours was not the oldest one. There's actually still one district out there still operating under the original 1977 district agreement that has never been updated. So that did make me feel a little happier. Most of them are still fairly old. One thing I did pull, at least in the new revision, is one of the districts actually did say that, put a timeline in there, that the intergovernmental agreement said it was only good for 10 years, that it could be renewed by a resolution, so it didn't have to get opened back up every 10 years, but could just be renewed at that city council level. But it does, to me, again, something that this document shouldn't have gone 23 years without being looked at. Whether we changed it or not, it got re-signed. But I guess what I'm hearing is that you are okay with me making some changes, bringing this back February-ish, I guess, or February is your guideline, that we can bring back to this organization. We can maybe beat it up a little bit and then send it out to the municipalities. Is that correct?
Yes.
Yeah, that's correct. I agree with that.
Imagine that anybody would have any better idea of what needs to be updated and how to approach it properly than you. So I'm anxious to see what you have put together.
Okay. I said I did, as I had mentioned, I did the two mayors and the town board president are aware that I'm bringing this up tonight. So this isn't news to them. I wanted to reach out to them just to make sure I wasn't going to get 3 emphatic "don't do it" kind of approaches. They are aware of that. I don't know who they have shared that with, but I will move forward with this and keep this on the agenda for next month then to bring forward.
Okay, sounds good. Thank you. Patrick, you want to discuss the biometric information privacy policy, which would be new?
Yeah, the last thing on the agenda is pretty short, and it's pretty short, and as I saw how really short it was, I don't even know that it's necessary. But the background behind it, I've shared with you. I think we've partnered, starting January 1st here, we've partnered with Dane County. This has been about a 4-year project that finally came to fruition. If you've been to any one of the Madison hospitals, if anybody's been fortunate enough, right, to utilize the services of our EMS as you wheel your way in there, it literally looks like a vending machine. We talked about it last month.
Some people get a pop, some people get bandages.
And some of them, it is next to the real vending machine.
Yep.
So I truly anticipate saving probably thousands of dollars, hopefully in medication costs next year. But part of that is when they purchase medications, purchasing, right? But they obtain them. We ultimately do get billed for them. But they use a fingerprint. So they have to put in an employee ID, a service code, and then actually do their fingerprint. So with that, did just a kind of a quick internet search of like, right, what's my liability having my employees' fingerprints on file? Essentially, there was some guidance out there that says nobody really knows. There's actually only 3 states, and Wisconsin is not one of them, that actually has federal state laws regarding the collection of biometric data, facial recognition, fingerprints. Most of the things out there are like big companies who use truly, facial recognition as you're walking through the door. I'm grabbing a fingerprint so that you can get some aspirin. So that's why it's pretty short. But we will have a policy, looking for a policy that covers this. Essentially, it said, this is what we're doing. We're identifying the only biometric we are currently capturing is a fingerprint, and for the reason why. Bottom line, right, as opposed to the 4-page template I got, none of that really applied to us. What it just says is that we use an external vendor. So when I grab their fingerprints, it actually goes to the infamous cloud. It sits with that software, collects, stores, and utilizes biometric data. I can identify who's buying what based on their fingerprint. That is the only reason I'm going to be using their fingerprint. And then as soon as they are terminated from our employment, that we will delete to the greatest extent that I can delete it, which is deactivating them from the system. I will delete that fingerprint. That's what the policy says. I have not sent this out to staff yet. I don't really anticipate there being a problem. They're all getting, I never anticipate, but we'll see.
One never knows.
One never knows. So I did send this out. If there's any further discussion or adoption, otherwise it's the usual. We make a motion to accept it, we second it, and then I send it out to the staff for 21 days of comment period, essentially. If there's any large comments, it comes back to the commission next month for possible revision, otherwise it becomes effective.
Any questions, discussions?
I have one, Patrick. I'm going to be the seedy guy this time. Kyle, are you still on? I'll use Kyle because he was on.
I'm on.
So Kyle goes and retires. And when you say you delete it, you deactivate it. Does that deactivate it? You can deactivate it at Fitch-Rona, but when Kyle puts his fingerprint on, say he's working for, Kyle retires from here, but he's working part-time for Sun Prairie. I'm just using that as an example. And Kyle goes and puts his fingerprint on, because Sun Prairie's using it too, just as an example. if you deactivate it, is it gonna go and say, yes, Kyle's fingerprints and Sun Prairie now, and it's okay? Or will it say, oh, this fingerprint's still in our record and it gets billed back to Fitch-Rona?
Nope, because it's a combination. Every employee actually has a unique employee identify number as well. So there's actually a 4-step process. When for me to go in and buy aspirin, I actually have to put in my employee number and my service number and my fingerprint.
So there's 3 things. Okay, that's what I was wondering about. Fine.
Yeah,
No
because
problem.
we already have people who currently work at other services who will have a different employee ID number, service number, but the same fingerprint when they go in. Now, there's always the case that they could screw that up, but mine will be deactivated the day he leaves. So,
I don't have a question about the policy. I mean, I'm ready to make a motion on passing that, but so does this really cut down on the amount of stock that we have and our process of pulling and throwing expired medications and all that?
It will.
Yeah.
It will. We currently keep, for the most part, with the exception about maybe, I don't even know that it's 2 or 3 drugs, all 3 stations are stocked with medications because that's how we restock.
Mm-hmm.
So there's I'm guessing we just ran the year-end report. Each one of our supply rooms, each one of our stations has about $15,000 worth of supplies in it. I would make a pretty good assumption that at least half of that is medication, because they're all going back and coming back. So we do our best to try to watch. We have a supply system that allows us to see what's at each station and we can move them around. But we have we keep supplies at every one of our stations. So with this system, there's I think 2 or 3 medications that are unique to Fitch-Rona. The example being nitro paste. We're the only service in Dane County that is using nitro paste. Everybody else is still using spray. We use paste in tablets. So we'll keep our own paste. We'll keep our own tablets. There's a couple of other things that I just like. We have our system better, our medications better. Every service will maintain its own controlled substances. That's not a unique thing. So every one of our stations will still have controlled substances. But for 80+% of all of our medications now, we will keep a small back stock at one station. So station number 2, which sits right in the middle, we'll keep 5 epinephrine there. So on the off chance you go to Mount Horeb, you run a cardiac arrest, you don't have to go to the hospital to restock. You can go to station 2 to restock. You're still in the district. You're back in service much quicker. But now instead of having 10 epinephrine at 3 different stations, I have it at 1 station and I only have 10 because worst case scenario, you run 2 codes like that. Oh my gosh, right? Somebody's going to have to drive up to St. Mary's and get 10 epinephrine.
Mm-hmm.
We're good, but on the off chance that our low use, high dollar glucagon, right, at $275 a vial, and I have to keep 3 of them in my truck because that's a calcium channel blocker overdose.
Mm-hmm.
So $700 worth of medications, and we keep that 4th ambulance completely stocked to drive it out the door. $700 times 4 ambulances, plus there's 1 at each station.
Yeah.
So this case, I will have 1. I mean, I still got to keep all of my ambulances stocked. That's just the nature of what it is. So we're going to still use that expense. But as opposed to having 1 at each station, now I will have 1 at 1 station. So I said, just keeping track of over the last 2 years, I threw away about $3,500 in expired meds last year.
Right. That sounds great.
So, and the Epic, again, shout out to Epic and their phenomenal support of our EMS community. Epic is actually paying for the operational cost for this year. So there's 0 cost to us to participate other than the cost of the medications itself. Starting next year, and that number hasn't come out yet, but there will be a cost that's splitting up that operational cost amongst the participating entities of Dane County. This is not actually just going to be at least opened up. Not just paramedic services, because there are EMT basic services out there that still there are defib pads in there, and then the IO needles, the needles that go into the bones, those are in there as well at $110 a needle. So even for that intermediate services that are out there, because I have to buy them in a box of 5, right? So fortunately, right, I'm able to throw away my pediatric needles every 3 years when they all expire. But I have to buy a box of 5 of them, so at $1,100, for what I'm buying for needles, right there, I have saved the cost of the $800 it's going to cost me to subscribe to this to let somebody else stock that machine for me every year. So every level, and then it'll be tiered. So an EMT basic service will not be paying what we're using because we're using a lot more than they are. This has been a phenomenal project. It is another huge shout out to Carrie Meyer from Dane County, who made this happen with the City of Madison coordination. Just Dane County is a phenomenal organization here that's very supportive of our EMS services.
So will this be a requirement for all employees to submit their fingerprint, or would they be able to opt out? And if so, would there ever be a situation where you could potentially have two people in a truck and neither one of them have given their fingerprint?
So far, I have not given the option for anybody to opt out. Nobody has asked to opt out. The software will allow, because the machines were owned by City of Madison's been using these for years. In talking with Captain Roman, who works with City of Madison, who kind of manages this program, she said they do have a couple of paramedics. Most of them have, or some of them have outside jobs. So, the guys who go and lay bricks, who have nothing left of their fingerprints. She said they just can't get them to scan. So there is an option in there to bypass the fingerprint, in which case it is just your PIN numbers. So there's still a way to verify, or at least process who is actually purchasing the medication. There's just that little extra quirk. If somebody has your PIN number, somebody could go use your PIN number to get medications. But again, all of the controlled substances, which is probably our biggest worry, like, right, oh my gosh, you're going to take Benadryl and take it home and use it at your house, right? We'll buy you some. But there's that little quirk in there that there is the option to opt out. I'm not offering that for the time being. Any other
Any other
discussion?
discussion?
I'll make the motion to pass the biometric information privacy policy.
Mike seconds.
All in favor?
Aye.
Aye.
Any opposed? Hearing none, the biometric information privacy policy is approved by the commission to proceed with the process of staff review, I guess, right?
Yep.
Any other business? Anybody have anything you want to bring up? If not, our next meeting will be February 18th at 7 o'clock. A motion to adjourn?
So moved.
Second.
Okay, all in favor of adjourning?
Aye.
Signify by saying
Aye.
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 Nobody's opposed, so meeting is adjourned. Hopefully next time I'll be able to get in.